We cannot predict the long-term health effects of COVID-19. Even though many people have contracted it and survived, we still are not sure how this coronavirus will impact our lives 10 or 30 years from now. But let's not look that far into the future. Today we wanted to discuss what we know so far about COVID-19 and diabetes, and the top strategies for managing the risks. Strategy number 1. Learn how to identify the typical symptoms. The CDC also reported that adults of any age with certain underlying medical conditions are at an increased risk of severe illness from the virus that causes COVID-19. The report continues to list certain illnesses that put people at a greater risk of contracting a severe illness from COVID-19, including being in an immunocompromised state, having cancer, obesity, smoking, or having diabetes. The combination of diabetes and COVID-19 is not ideal, and the best course of action is preventing that from ever happening. How? At first, you should know more about it and its symptoms. Statistics show that most people who have contracted COVID-19 experience no symptoms or mild symptoms only. The most common mild symptoms of this coronavirus are fever, dry cough, tiredness, headaches, and body aches. This could explain why COVID-19 spreads so quickly in the community undetected. Many infected people don't even know that they're infected and don't take additional precautions. However, some COVID-19 patients experience more severe symptoms, such as difficulty breathing, chest pain, loss of speech or movement. These symptoms sometimes are severe enough to warrant hospital admission, even admission into the intensive care unit, ICU. Now that you know the typical symptoms of COVID-19, let's find out the main methods of protection against it if you have diabetes. Strategy number 2. Understand how to protect yourself. COVID-19 typically spreads throughout respiratory droplets released into the environment after the infected person coughs, sneezes, or merely talks. Naturally, it's a matter of how close the infected person is to you. The closer you are to each other, the higher the risk. People who are confirmed to be positive for COVID-19 need to be isolated from others to reduce transmission risk. It means living in a separate room, using a separate bathroom, and even having a personal trash bin. People who might contact an infected person, especially healthcare workers, need to use personal protection equipment, PPE, and maintain strict hygiene standards when interacting with COVID-19 patients. Preliminary studies have shown that young, healthy patients have the best chances for a positive outcome, with many taking a full recovery. However, as mentioned, this also makes them more likely to be silent spreaders of this virus. Even if you get infected with COVID-19, your chances of full recovery depend on the next strategy. Strategy number 3. Carefully follow your routine. If you've been diagnosed with diabetes, you know that this condition requires daily monitoring. You need to take your medication as prescribed, observe your diet, and make sure that you maintain a healthy lifestyle. Ensuring your diabetes is well controlled is even more critical during the COVID-19 pandemic, because any long-term illness that you have puts you at a greater risk of suffering severe symptoms if you contract the virus. As many of us with diabetes know all too well, diabetes is an illness that can easily slip out of control if we let our guards down. With this pandemic around, we can't afford to let that happen. However, we do have some good news. The American Diabetes Association states that your risk of getting very sick from COVID-19 is likely to be lower if your diabetes is well managed. This means that one of the best preventative measures that you can take is to do everything that you can to ensure your diabetes is well controlled. As we discussed earlier, this involves taking your medications as prescribed, maintaining a healthy lifestyle, and paying more attention to your diet. One of the best ways to stay fit is to watch what you eat. Ensure that you eat healthy foods that are nutritious and not too high in sugar. Remember, eating healthy doesn't have to mean eating foods that you don't like. With some planning, you can have a healthy diet that is both tasty and flavorful. Check out our video that defines the best way to manage diabetes. You will also find a link in the description. Maintaining a healthy lifestyle while having diabetes is entirely possible. With the COVID-19 pandemic still circulating, make sure that you take all the necessary precautions. Remember, simply ensuring your diabetes is well controlled goes a long way to fighting this deadly virus. We would love to hear your thoughts in the comments. If you loved this video, make sure to subscribe to our channel. More diabetes-friendly content is coming up.